bizzibox's expert information on syphilis. What is syphilis?
Syphilis is a common sexually transmitted disease which generally will cause a painless ulcer on the genitals or the point of contact. So that may obviously be oral, maybe genital. Very often it will cause the appearance of painful glands in the area in which the sore appears.
How do I get syphilis?
Syphilis is a sexually acquired infection. So you would need to acquire syphilis, then you'd need to have sex with somebody who actually had it at the time.
How common is syphilis?
Syphilis will vary in prevalence in different communities. So certainly in the heterosexual population in the UK, syphilis is very rare, very, very rare. In the gay population, bisexual population is very common. So we've had a huge, in the last few years in the UK, huge upsurge in the number of syphilis cases of maybe up to 5,000 or 6,000%.
Can syphilis be passed through any type of sex?
Syphilis can be passed through any sex, including anal sex, vaginal sex, oral sex, even sometimes casual contact. Syphilis of all the STDs, sexually transmitted diseases, is the most infectious.
What are the symptoms of syphilis?
Syphilis will usually present with a curious-looking, painless ulcer on the genitals or tongue or lips, and that ulcer will then disappear over time, and often it'll go away on its own. Then maybe 6 to 12 weeks later, it'll reappear, but as a whole body rash, particularly on the palms and the soles of the feet.
How do you test for syphilis?
Testing for syphilis is easy, it's straightforward. We can either take a sample directly from the lesion, which is called a chancre, or we can take a blood sample. The blood sample allows us, one, to diagnose, and two, to monitor the effectiveness of the treatment, because it gives us a score. So blood samples are best.
How is syphilis treated?
Treatment for syphilis is antibiotics, either by, and preferably by injection, because that's the benchmark. But you can treat syphilis by oral medication as well.
How long does it take to treat syphilis?
The key to clearing up syphilis is a successful identification. So once you've identified it, usually the first injection will clear it. Most usually in the UK we would give 2 injections separated by a week, and we may vary that depending on different circumstances.
www.bizzibox.com